Hello ladies and welcome back to my channel. My name is Aisha, aka Nurse Aisha. I'm a registered nurse here to spread awareness on preventative health and lifestyle choices for women. That is my focus so you can lead a healthier and more informed life. Welcome back to my channel. For those of you that are new here, please do not forget to subscribe, like and comment on this information that I put out here for you. This is how we grow as a community and I get to make more content that you can enjoy. So today, as you can see, perhaps with this pin, I am here to talk about HIV/AIDS. It is December. We did miss the 1st of December, but that's okay. I am here with a fellow nurse that works specifically with these issues. Her name is Lisa George Svahn. You'll get to see her and I get to talk to her about this important issue that she has very close to her heart. Don't forget to subscribe, like, and comment. Hi Lisa.
Hi Aisha.
Welcome to my channel. Thank you so much for agreeing to this meeting and interview.
Thank you so much for inviting me.
How are you?
I'm happy to be here. I'm great.
All right, so we're here to talk about HIV/AIDS.
Mm-hmm.
And we're here at your place of work,
Yeah.
or one of your places of work.
Yes.
You still work as a clinical nurse?
Yeah.
Where do you work?
Yeah, I work in primary care at
Yeah.
Rinkeby Vård Central in Stockholm.
Yes.
And so there I work with community health. And then here I work with HIV prevention and testing.
All right.
So similar yet different.
Yes.
So work.
So what is this place? This is amazing. You have a really nice place here in the middle of the city.
Yeah, and it's supposed to feel really welcoming.
Yeah.
And we are a nonprofit organization.
Yes.
We've been working with HIV since the beginning of the HIV pandemic in the 1980s when
Yes.
it first came to Sweden. First in the beginning with a focus of taking care of people who were affected by HIV directly with their direct care, making sure that their basic needs were being met.
Yes.
But as HIV changed from being a deathly diagnosis to being something we could live with,
Yes.
once the medications arrived in 1996, then the focus of our organization changed to providing support for people with HIV. Because even though we have really great medication now, treatment, people live long, healthy lives despite having HIV, there's still a lot of stigma related to HIV.
All right.
And so people continue to need support.
Yeah.
So this is a place where people can come for different types of support, activities, community, peer support, but we also offer HIV testing. So
All
we
right.
have rapid testing that's completely free.
Yes.
It's anonymous, and you get the results in 20 minutes.
Okay.
And you don't need to tell your name. You don't need to have your migration status doesn't matter.
Okay.
You're just welcome to come and get tested.
That's very accurate. Not to have a migration
Yeah.
status of any kind.
Yeah.
Show that you are eligible to live in this country.
Exactly.
Yeah.
Everyone is welcome for testing.
Yeah.
And even if you're just visiting Sweden, you're also welcome to come by for testing.
All right. So HIV/AIDS. Tell us the basics that we need to know about the disease.
Yeah, so I can speak from Sweden.
Yeah.
We have about 8,500 people living with HIV,
Okay.
who live with HIV. And what's so amazing is over 99% of those people have treatment for their HIV, which means that it's very well controlled. They don't have any kind of symptoms related to HIV. They're living physically very good lives.
Okay.
They're very healthy, they work, they have families, they have partners. But we estimate that approximately 1,000 people in Sweden do not know their status, have not been tested yet.
Okay.
And so that's something that our project is seeking to work on, is that we go out into different communities and offer information about HIV and offer testing as well.
All right. So 1,000 people, and that is people living in Sweden, or
Correct.
So
Yeah.
we don't count the ones that are coming in and out of Sweden.
No, those people we don't really, can't really count in the
Yeah,
same way.
yeah,
But people who are living in Sweden, we estimate that it's about 1,000.
So how is the getting the HIV/AIDS here? Is it, what is the cause of it today to 2024?
Yeah.
How can someone afflict HIV Is it here in the country or is it outside of our borders? What happens?
Yeah, so HIV is present everywhere in the entire world, including Sweden. And some people acquire HIV before they come to Sweden, if you've moved to Sweden. But people acquire HIV in Sweden as well. And it's because and it's usually through heterosexual sex. And it's usually because your partner doesn't know that they have HIV, hasn't been tested. And so that's our main message, is that every adult should be tested for HIV at least once.
And you said heterosexual.
Yeah, the majority of transmission in Sweden is through heterosexual sex.
Because when it used to be a pandemic, it was considered to be something that you afflicted if you were of a homosexual.
Correct.
Okay.
Yeah.
So now it's changed.
Yes.
So anyone basically having heterosexual sex.
Yeah, exactly. And of course, men who have sex with men, gay men, also acquire HIV. But the majority of people in Sweden who have HIV are heterosexual people.
All right. So what is the easiest way to prevent getting afflicted?
So the easiest way is to make sure that you get tested and that your partners get tested well, to have those conversations, even though it's not easy. But to ask if you have a new partner, or even if you have an older partner, hey, have you ever been tested for HIV?
Yes.
When were you tested last? And then you're always welcome to come together for an HIV test. That's the optimal way.
Yes.
Of course, condoms provide great protection for HIV. So if you're able to use a condom, that is also a wonderful way to protect.
Is there any other way that you can protect yourself?
Yeah, so if you are in Sweden, there's something called PrEP, which is pre-exposure prophylaxis, and it's available in a lot of different countries. In Sweden, it's only available for men who have sex with men and for people who have a lot of sexual partners. And that means basically that you take a tablet every single day. And that prevents you from getting HIV. So if you think about it as like if you go somewhere where there's a lot of malaria, you would take prophylaxis. You would take a tablet so you don't get malaria.
Yes.
It works the same way. So that way you don't get HIV. But that's really for people who are at very high risk of acquiring
and who
HIV.
are the people that are at very high risk?
Yeah, so people who have many sexual partners.
All right.
Yeah, so if that's a category you think that you fall into, or if you're worried about that, then there are clinics in Stockholm where you can get assessed if you're eligible for that treatment.
Okay.
Yeah.
So it's something that your doctor has to decide.
Yeah.
Or you together with your doctor.
Correct. And then you need to go to a special sexual health clinic where they can prescribe that medication for you.
All right. Okay.
Yeah.
How easy is it to have the conversation within, let's say, a marriage? If you've been married for many years, can you have that conversation?
I think it depends, on your relationship with your partner. Of course, it's not easy.
Yeah.
But it could be that this is something I like to approach it. This is my health. I care about you. You're my partner.
Yes.
And I care about your health as well. And I want to take care of both of our, my health and your health together. We want to grow together, grow old together.
Yes.
And so to try to approach it in that way, that this is something we do as an act of love for each other.
And so I'm thinking beyond Sweden borders. So I'm thinking my community. My community has been very much, my Ugandan community, we've been very much affected by the disease, both when it used to be a pandemic and even today. Obviously it's getting better. And I'm thinking that this is a conversation, especially if you have a partner who is stepping outside or maybe living in a marriage where there's different partners or wives, you say polygamous marriage. Is that something that you have seen here, that people living in polygamous marriages or relationships? Is that something that you even assess here, talk about?
Absolutely, because many people come to us for testing because they have had partners outside of their marriage or outside of their monogamous relationship, that there has been, whether or not they're open with their primary partner about that or not. But that's a conversation we have, and we encourage people to, as much as possible, to disclose to their primary partner so that they have a chance to get tested.
Yes.
And in Sweden, there's a law that if you test positive for certain sexually transmitted infections, then we do partner tracing. We do contact tracing. So for example, if I tested positive for HIV and you're my nurse or my social worker, you would find out, okay, who have been your sexual partners? And then anonymously, without saying my name, you'd say, hey, you've had contact with somebody, you've had sexual contact with someone who's had HIV, and now you need to go get tested. Or you've had contact with someone who has chlamydia or syphilis.
So you get this in your...
Information, yeah.
Yes.
So you would get a call from a healthcare professional and say, you've been in contact with HIV, we recommend that you get tested as soon as possible. And that's always free as well. Okay. But we never disclose who the partner is who is positive.
Okay. Is it mandatory though?
It is mandatory.
Okay.
Yeah.
So what if that person doesn't show up?
So we give them many chances to show up. And there's people who, I don't work with this, but the people who do work with this, it's according to the law. Yeah. So if you can't reach that person or this person doesn't show up, you give them quite a bit of time. But then otherwise it goes to the public health authority, actually. And they have the mandate, since it is a contagious infectious disease that needs treatment. They have the authority to come knocking on your door. So I usually recommend to people, please come to us. It's much nicer than having someone come and knock on your door. We're happy to come here and test you, and we'll test anonymously, and we don't need to write anything in the medical record.
Okay. So how unique is this law, and what are the details of this law?
I think it's pretty unique to Sweden. I come from the US, and we don't have as strict laws with like sexually transmitted infections. You have to inform your partners about if you have HIV, it's recommended that you inform your partners. Yes. But we don't do this contact tracing. We ask you to do it for HIV. But for other infections, we don't do it. So for HIV, they will really try to find your other partners and have them come in for testing. Right. But it's not very strict in the same way as it is in Sweden.
I guess it's hard, being that it's different states and different laws.
Exactly. Yeah. How does it work in Uganda? I'm curious.
Well, I don't know. I don't think that we have a law.
Okay.
I stand corrected. If anybody knows about this, please let us know in the comment section. But I've not heard of it, and that is why I asked you about the knowing your status and asking your polygamous partners, because that is very common that a lot of people are living in polygamous marriages and have partners outside of the marriage, which is really not disclosed to the other partner. So that means that I've heard so many people talk about getting tested every third month just to make sure, just out of their own security, to feel like they're secure, but not really having the conversation with their partner, which is really sad. But we have a law here in Sweden that protects us from that. So then, if anything comes up, they will have to disclose this information.
Exactly. And the person themselves don't have to disclose. So I think that's what makes it a little bit easier as well. Yeah. So I don't have to go directly to my partner, even though most likely they can figure it out, right? But that it's another nurse or a social worker who's calling them and saying, hey, you need to get tested. You've had contact for HIV. So I think it makes it a little bit, and it gives you maybe some time to disclose.
So the law is unique, and the details are there mainly to protect.
Yeah, because it's considered like a public health, something that's good for public health.
Yes.
So there's a whole bunch of, it's not just HIV, but there's several diseases that are in this law.
Yeah. Okay. All right. So I want to talk about the face of HIV/AIDS. What does it look like? Is it, because with the shame and the stigma around, there's somehow this thing, you have to look a certain way. If you look good, if you're a good-looking woman or man, you cannot have HIV.
Yeah.
How true is that?
No, so that is completely untrue. I think we all have these old images, of HIV when we have these images of when people were very sick and before there was treatment and you became very frail and you became very skinny.
Yeah.
And that we don't see that today. You see
I believe even the name of HIV in my language is skinny.
Yeah.
Yeah.
So so it really holds these, old stereotypes that we have about HIV. But now HIV is a completely healthy person. They take one tablet a day. They don't have any side effects of their medication. They really lead healthy lives. And so you can't say from the outside of looking at a person, they look like you and me and anybody else that you see on the street. They
So
look
basically
like
the face of HIV is a lipstick chick looking really well.
Yeah, exactly.
And not beat down and skinny and just looking raggedy.
Absolutely not.
Same goes to the men as well, obviously.
Correct.
Yeah, perfect. Now that we got that out of the way, so before you get tested for this disease, what are the symptoms that you can expect?
So that's the tricky thing about HIV. You most likely don't have any symptoms. Some people, when they've just been exposed to HIV, a couple weeks later, they can have flu-like symptoms. And we call that primary infection. But those flu-like symptoms feel like any other kind of like cold. If you're getting the flu, or you have a sore throat, maybe you have the chills, a little bit of fever, but that goes away by itself without any treatment. And then you have zero symptoms for many, many years. And that's the problem with HIV, is that it's not giving us any symptoms until it gets to a very late stage when the immune system is affected, and then we start developing other infections. So that's the problem, is that many people don't get tested because they don't have any symptoms.
So this reminds us of the non-communicable diseases, basically, until it's really late in the stage that you start getting the symptoms.
Exactly. Just like having high blood pressure, you can go for many years not knowing that your blood pressure is high.
Exactly. Perfect. So you cannot really tell from looking at a person, and you cannot tell from any types of symptoms quickly that you have it. So you definitely have to go get tested.
Yes.
We got that out of the way. So now you talked a little bit about treatment. So when it was a pandemic, when did the treatment arrive, and how did that happen? What was the road to the stabilized treatment that we have today?
So we had the first treatment came in 1996, and many people remember AZT because it was really the game changer when it arrived, because people who had received a death sentence that they were going to die suddenly survived. So it really changed like the trajectory of this disease, and people started surviving. But those first medications, of course, had a lot of side effects. People were very sick. There were so many tablets a day. I remember I worked in New York City at that time when I was young, and people would have a whole handful of tablets.
Really?
Yeah.
Like, so you've seen this all the way from the beginning.
So from the beginning, early 2000s. And now, till today, we have people who take 1 to 2 tablets a day, once a day, and have no side effects. So it's really amazing in a relatively short amount of time how much we've achieved in like the science.
28 years.
Exactly. And 1 to 2 tablets a day. We even have an injection treatment. So if you're somebody who doesn't like to take tablets every day, or if it's hard for you to remember to take a tablet every day, you go see your nurse every 8 weeks, you get an injection, and you just go to see your nurse every 8 weeks. And now there's studies in the pipeline as well to hopefully extend this, so it'll be injection just twice a year. And that gives you your full treatment for HIV.
A lot has happened.
Really?
A lot has happened. This is completely new to me, because I don't work with the I haven't actually worked with HIV/AIDS at all. Ever. Not that I know. Well, I've met a few patients, but usually they are on their treatments. What I do know, though, is that they're very, very rare, these treatments, because so many of my patients, or people that I've met with HIV, we usually recommend them to come into, if they're receiving treatment at a hospital, to come in with their own medication, because we don't have it in our storage or anywhere. Because there are so many types now. Can you disclose a little bit how do you choose? How do the doctors choose the medication?
So they try to choose a type that both the patient will tolerate well, but also depending on maybe your age, like how your kidneys are doing. So we usually, when we have a new patient, we take a lot of blood tests in the beginning just to see, do you have any other infections? And they also look at your genetics, like, do you have a genetic type that maybe you'll be allergic to certain kinds of medication. So it's based a lot of that, but usually there's like a first line treatment, and all countries operate that way. There's like a first line recommended treatment. for HIV. And then we are very individual based. So we say like, oh, how are you feeling on your treatment? If you're not feeling well on your treatment, we change to something else. Everybody should have a treatment that they tolerate well, that they feel good on, where they can have like a very high quality of life. And also, like I said, 1 to 2 tablets a day.
And it's comorbidities as well. If you have hypertension or any other type of disease, then the medication will be chosen to be appropriate so that it doesn't affect the other treatment that you have.
Right. And people who have HIV usually go to the HIV clinic twice a year once you're on a good treatment. So you don't need to go more than twice a year. So you have your blood work, and we really check, your cholesterol and your blood sugar and things like that.
So what are the side effects to expect if you're just starting your treatment?
I think just like any medication that we start, we feel some side effects. We feel that, something's in our body that our body needs to get adjusted to.
Yeah.
So can have some nausea, some stomach problems, maybe feeling a little bit tired. But I usually say to my patients, these are all like they're going to go away. This is just a short period of time where your body is getting used to it. Of course, you shouldn't be vomiting or having severe side effects like a rash, but nausea, some stomach discomfort is normal. And that's going to go away within a few weeks.
All right.
Yeah.
So how is, with your patient, how is it met when they get the diagnosis? How do they react? And are you the one that actually tells them and gives them the diagnosis or the information that they have?
Yeah. So as the person who tests the recommendation, and I can imagine this is the standard across the world, that the person who tests should be the one who gives the patient the information. Because I've been with you, we've had a conversation during the 20 minutes that we're waiting for the test to finish. And of course, I think like no one wants to hear that they have any kind of illness, even if it's chronic, even if it's not deadly. It's really hard to hear that your life is going to change in some way. And I think, unfortunately, because there is still so much stigma related to HIV, that's the hardest part to bear, is how am I going to tell my family? How am I going, are people going to stop wanting to be around me, stop wanting to hug me, stop wanting to let me play with their kids?
Is that still happening?
Unfortunately.
It is.
It is. It's really sad. And I say to lots of people that I try to give information to, HIV only transmits through unprotected sex when the person does not have treatment. And that's something I would really like to say to everybody listening today as well, is that HIV, when you have HIV treatment, you cannot transmit HIV to your partner, even if you do not use a condom. And this is something really important. So knowing your HIV status is so important, because then you protect your partner as well. So all of your sexual partners are protected by you having this medication. So that's why I really encourage people to get tested. But I think the biggest fear for people is telling others.
Yes, exactly.
And the reaction that they might have.
Because still, even if I do meet someone with HIV/AIDS, I would still want to know, right? I'll still want to know, because maybe it's crucial information if you're going to start a relationship, because relationships are hard. And now we're getting into a relationship with a disease, that used to be a big disease with little letters, but it's still, it's not as enormous as it was, but I would still want to know. It's just, I guess, kind. It should be, or just common courtesy to tell someone that you're carrying this diagnosis. It should be. It's not like, you just have hypertension, or you have, well, I don't know, but still crucial information, even though you cannot transmit it.
Exactly. And I think that it's that way with a lot of things that what we choose to share with our partners. Is this going to be a one-time relationship? Are we just spending time together tonight and never again? But I know that you're safe with me. I have HIV, but I'm on medication. I won't transmit to you. But if you're thinking, I'm going to be in a long-term relationship with this person, then that's something we talk about a lot, is with disclosure. Because for the person living with HIV, you need to be able to be open with people and have them feel like that you're somebody I can trust, and you're not going to leave me because I have HIV. So it's important that you feel safe in your relationship, both for the person who lives with HIV, but also for their partner, and that you can have that open disclosure.
Yeah.
But I think because we still have pretty low knowledge as a society, and that's like all societies. I think it doesn't matter. Even when I talk to nursing students, we have lots of nursing students who come to visit us, medical students, there's very little information that you get about HIV. And so they're really surprised to hear this information.
Yeah.
And so I think because there is such low knowledge about HIV and there's such high stigma, that people are truly afraid about disclosing their status.
Yeah.
Because we still have, I can remember many examples of people being left by their partners, being left alone with a child, even though they've disclosed.
Yeah.
So that fear is very real. And I think that's something that we all have a responsibility to make sure that we don't stigmatize people who live with HIV.
I feel though this is an intimate relationship that we're talking about.
Right.
How is it to disclose to your friends? I mean, obviously it's not mandatory, you don't have to, but do people actually tell their friends, their closest friends? Is there still that fear of friends knowing?
I had many patients who had chosen not to tell a single person because they heard how the talk went in their communities. Like, oh, maybe we shouldn't share this plate. Imagine, they would joke about it.
Oh.
Imagine if somebody has HIV, we shouldn't share this plate of food. Or, oh, they would joke about it in this way where you would feel like, oh, this is not a safe space for me to talk about my HIV. So their only chance to really talk about it was with their nurse. And it shouldn't be that way.
No, it shouldn't. Especially not now.
No.
I mean, what happened in my community, like I told you, my community has been very much affected by this. But I guess people walk around and just, but you don't know.
Right.
So you know, but you don't talk about it. You can find out maybe hearsay, people talking, but never that person disclosing to you that they actually have the disease, which is really sad, because then we talk about very much on this channel, suffering in silence.
Right.
So that still happens, even though they're on treatment and are doing well with the virus and all of that, but they're still suffering with this information, I guess, within them, and the shame and stigma, carrying it every day, all day, which is really, really sad.
Exactly. So the HIV stigma, both affects the person who has HIV, and their mental health. And being so isolated, but it also, HIV stigma leads to that we don't get tested because we're so afraid of, what if I do have HIV? What is that going to do to my work, or to which it should not, affect in any way. I know plenty of doctors and nurses who have HIV. There's no job that you can't do because you have HIV. But because the thought of having HIV is so great that we don't get tested. So it's also a barrier. Stigma is a barrier to getting tested and treatment.
So again, going back to the face of HIV, doctors, nurses, CEOs, all of them can still carry the virus.
Because, we're all adults. Having sexual relationships is part of being a healthy adult, right? That we have close, intimate relationships. And so when we do have sexual relationships, there is a risk for HIV. So it's something that can affect any one of us.
Yes. All right. So how is compliance with your patients, and how important is it with compliance?
So compliance is very important, as it is for all of our, chronic illnesses that we have, including diabetes and high blood pressure. But HIV medications are extremely strong. I always say to patients, do your best, try to take your medication every day. But if you miss one pill here and there, it's not the end of the world. It's not like your viral load will go up really quickly. These medications are very, very strong. But that being said, you should do your best to take your medications every day. But it allows for some human error. We're all humans. We can miss a tablet once in a while.
Okay. Great. So we've talked about the disease in general. We've talked about how to get tested. We've talked about a little bit about the stigma and all of that. And then we've talked about disclosing, treatment. So tell me more about Noah's Ark, which is basically Noah's Ark here that we are, and the work that you do with HIV/AIDS.
Yeah, so I work on a project. I'm the project lead for a project where we're trying to expand HIV testing outside of our walls here, where we're trying to bring HIV testing out into the community.
Yes.
Both in the goal is to lower stigma, increase knowledge, but also offer testing. So it doesn't become like, oh, I need to book an appointment or I don't know where to go. But we go to lots of different community events where we offer HIV testing through our rapid test, where you get a result in 20 minutes. We try to partner with other organizations because even though Sweden has these really great outcomes with our HIV treatment, everybody's on treatment. Our HIV treatment is completely free in Sweden. We have really healthy people living with HIV. About 18 to 20 people every year, we find them very late, where the immune system is affected, they've had a chance to already become sick, and then you need a lot of care. You know, they don't die, or maybe there's a couple of people per year who die, unfortunately, but it takes a lot, and a lot of suffering on that person's part to help them get their health again. So that's why we want to be out in the community. So we try to find people at an earlier stage of their infection before they have a chance to get sick. And then the other plus side of that is if we find people earlier, then they don't spread to their partners either. So there's two goals with this project.
What does Noah's Ark do specifically for this community? Because it is a community.
Absolutely.
You work with a community of people here. And when you described it from the beginning, it was really beautiful. So tell us more about what you do.
So I do mostly with testing, but this community here is also a place for support. Both for peer support so that people can talk openly, like we talked about, that there's so much stigma that you can't talk openly about your HIV status. Be able to like share your experiences, like, okay, well, how did you disclose to a partner? Like, tell me, how did that go? You know, what was their reaction, so that I can feel like I can do that. So we offer peer support in lots of ways. We have Monday dinners where people who have HIV and their closest friends or closest family can come for a free dinner where we can just sit and be together, relaxed, in a space where it's not a big deal to have HIV. No one's going to question you or ask or
judge you.
Exactly. So we are really focused on peer support. And if we look at the studies, it shows that when you do have peer support, it both helps your mental health, but also it increases adherence to medication. You want to take care of yourself because you have a community. We all need a community. So it's really, really essential.
You have something, you have a why to live for. What else do you do? I heard that you celebrated 1st of December.
Yes, we did.
How did you celebrate?
So we had several activities here in the house. We had an open house so people could come and have coffee, have snacks. We served a dinner for everyone who came. We had lots of education opportunities.
Outside of the clinic?
Yes. So we stood in the city and we invited people for free drinks and free snacks and had a quiz about HIV. So people had a chance to win different prizes depending on how many answers they got correct. So just trying to like increase knowledge, because we know if we can increase knowledge, we can lower stigma as well.
And these questions, just disclose one of the questions, that the misconceptions that people had, and how can we tackle that?
So I'll quiz you, Aisha. We'll see.
Oh my God. What, right now?
Yes, I'll quiz you right now. So one of our questions was, I'm pregnant and I have HIV. Will I give HIV to my baby during birth?
So it's a yes or no question.
Yes or no?
No.
And why won't I give HIV to my baby?
Well, because you're on medication. Hopefully, you're on medication. So that will protect the baby. So you go to a specialist nurse midwife so that you can have a planned birth that is safe for your baby.
Correct.
And I believe you might not be, I'm not quite sure about that though. You might not be able to breastfeed.
That is correct. So that's slowly changing. We're the only country in the world actually that does not allow a person who has HIV to breastfeed their child. So we're the only one in the world who has a very strict law that you're not allowed to breastfeed. But they're starting to slowly change that. So if you came to me and said, I would really like to breastfeed
Okay.
my baby, because that's also stigmatizing. In a lot of our communities, if you don't breastfeed, people start to wonder, why aren't you breastfeeding?
Okay.
And so that can also be another additional layer of stigma if you don't breastfeed. But now they're going to be doing trials where they're allowing women to breastfeed, but they'll be testing the baby very frequently to make sure that there's no transmission.
Okay, so that was a question that many people got wrong.
Yeah, so they didn't know that. They thought that if you have HIV, you would transmit it to your baby.
Okay.
But in Sweden, we haven't had a child born with HIV since 1997, and that's because of medication. Yes, so well done.
Well done, really. That is 27 years? Oh, wow, that is amazing.
Yeah.
And that doesn't look the same, obviously.
Yeah, unfortunately. And it's because we test every single woman who's pregnant in Sweden for HIV.
Those are the first tests.
Yeah, exactly. You get tested for a lot of different things. Your immunization status, hepatitis B, and HIV is included in that. So that screening is really important because we usually find several women per year who have HIV who didn't know. And it gives us a chance to both help them but also protect their child.
So this community, Noah's Ark, welcomes women, men, heterosexual.
Yeah. Everyone's welcome.
Community, LGBTQ community, everyone is welcome.
Yes.
And you all sit together and have this beautiful community here.
Yeah, we do. And lots of different activities. Everything is free. We just really want people to feel welcome, to feel safe, and absolutely never feel alone.
And no one should feel. It's not even governmental. It's not.
No, we get money from the government, but from different funding. Yeah, so we get different funding to have it. So that we can offer these activities for free, and make sure that people who have HIV have the same quality of life. It shouldn't matter if you have HIV or not.
You can come from any community.
Yeah.
Whatever.
Absolutely.
So you're welcome here.
Yeah.
Sit with people, talk to people who are knowledgeable about this.
Exactly.
Yeah. Because I can hear that you have a lot of knowledge about this disease. So Lisa, wrapping up the conversation, this amazing conversation that we're having, is there anything else that you want us to know more about this project and anything that you want to add? Yeah, so if you have any questions about HIV, I hope you'll feel free to get in touch with me, get in touch with Noah's Ark. Aisha, I think you'll have my contact information. Yes, absolutely. You'll find that in the description box. Yes. Yeah, so please feel to send a question, there's no bad questions, or just feel free to get in touch with me. And know that it's really important to just get tested. Yeah. I think that's my most important message, because this is a very, very treatable disease. We can't cure it yet. There's lots of studies working on a cure, but it's a very treatable disease once we find it on time. So no one should have to suffer physically or mentally and feel alone with HIV. I do have a last question though, just to add on to that. As a woman, because on this platform we focus on women's health, so I thought maybe we could talk a little bit more how vulnerable it is as a woman to have this disease. Yeah, and we have specific groups for women here at Noah's Ark, just because there are specific things we want to talk to each other as women. Like, how will this affect me when I'm pregnant, or what will it be like? How can I breastfeed in a safe way? So it's important that we have that support with from each other, I think, as women. And then just as women, we are more susceptible or vulnerable to acquiring HIV because of our anatomy. Since we are the receiver when we have sex. So that's also something to think about, is that sometimes it's not easy to ask our partners to use a condom. So that makes us also more vulnerable. We're very dependent on our partners to protect us. And there's a way that you can also protect yourself. There's this female condom. Yes, there's a female condom, which isn't so user-friendly from my experience with talking to lots and lots of patients. But kudos if you've succeeded. It's a little bit more expensive, but I hope it's available where people can access them. That is something that maybe you should let us know if you've tried this and it's worked. Yes. And why is this? Why is it so hard to make a female condom? I think because of our anatomy, it's like something so it looks like a ring. I don't know if you've seen the female condom, but it's a ring, and then it's like a bag that goes inside the vagina and then covers
the entire like inside of the vagina.
Yeah.
So then this bag is, so the ring is hanging outside of
Okay.
your body.
So it's a whole project.
It is a project. So it's not the
Okay.
same, it's not as easy to use as a male condom.
Okay. So, all right. Everyone is welcome. I'll put the information in the description box. And no one should be afraid to come here, whoever you are, whichever community that you come from. So with that said, thank you all so much for watching. And thank you, Lisa, for coming with this new information to us. And I hope to see you soon in my next video. Thank you so much. And don't forget to subscribe, like, and comment on this video so we can grow as a community and I can get to create more material on health prevention, basically. Thank you.
Thank you, Aisha.
High five.